Hi, today we'll be discussing erectile dysfunction. And this is a very sensitive topic in the sense that it affects very sensitive and important parts of the body, and not everybody would want to come out and own up to having this problem. Like, you see, people that have problem with their sight or hearing will definitely say, I have problem with my ear, I have problem with my eyes. But you see, when you have this problem with this particular disease condition, people don't usually own up to having it, and thereby you're restricting help and healing coming your way. And then today I am going to explain everything you need to know about erectile dysfunction, just because I have you at heart. So erectile dysfunction is a penile disorder that affects your ability to get and maintain an erection firm enough for sexual intercourse. Remember, get the erection and maintain it throughout the sexual intercourse. And then it has different categories. Firstly, we have the vascular erectile dysfunction. Now, the blood vessels that send blood to the tissues in your penis to help it create and maintain erection, or the valves that normally holds blood in the penis, are affected. And then secondly, we have the neurogenic erectile dysfunction. Now, this happens when there are problems with the nerve, and thereby preventing signals from moving from the brain to the penis to create an erection. And this is usually as a result of stroke, when you have pelvic surgery or pelvic injury, and then trauma. And then we also have the hormonal erectile dysfunction. Now, this happens when you have issues with the testosterone, or you have issues with thyroid, and thereby affecting your ability to create and maintain erection. And then we have the psychological erectile dysfunction. This happens when you have psychological conditions that affect your feelings, your thoughts, and your behavior, thereby affecting your ability to create and maintain erection. Now, what are the signs and symptoms of erectile dysfunction? This is simply what you will see, or like a pointing light, something that is helping you know if you have this, or things are not okay with me. Firstly, only being able to get an erection before sexual intercourse. Like, before the sexual intercourse starts, you have erection, but when you want to start, you're looking for the erection. And then secondly, if you're able to maintain erection before sexual intercourse, and then while you're in the middle of the activity, the erection disappears. And then thirdly, if you are not able to get an erection at all. And then lastly, if you require a lot of stimulation to maintain an erection. Now, what are the causes of erectile dysfunction? We have diabetes, high cholesterol, hypertension, epilepsy, chronic kidney disease, stroke, testosterone deficiency, issues with thyroid. We have penile fracture, pelvic surgery, injury to your pelvic bones, low self-esteem, anxiety, depression, alcohol, marijuana, cocaine, when you take all these stuffs. And then lastly, when you have genophobia, which is fear for sexual intimacy. And then how can you prevent erectile dysfunction? Firstly, you have to learn how to manage stress properly. This is because when you're stressed, it tends to affect every aspect of your body. Ensure you learn to manage stress properly, and then reduce your cholesterol intake. Ensure you maintain a healthy weight. Become physically active, that's exercise regularly. Avoid smoking, avoid alcohol, and ensure you get quality sleep. Hope you learned something from this video. Please do well to like, share, and subscribe, and ensure to turn on the notification bell to see more videos like this. Thank you.